Please, Senator.
Thank you. Dr. French, I was puzzled a little bit by the first part of your presentation because it sounded like, from your perspective, any option other than a DC was not an appropriate option. And I sat here thinking, she does know they're going to close. And so, you know, since you said that you do have recommendations, I hope that we can get them in writing or something, because I do want to hear from your perspective what would be helpful. I heard there at the very end some issues, so I hope that we can get that. Because I also know that, quite frankly, that there are challenges at Sonoma. And so we do have to figure out a community-based system that will provide all the supports that you expressed concern that the community has the capacity. So I would like to hear your recommendations. Quick question with regard to the comment about, I've heard it referenced a couple times that there were beds held during the Ag News closure. How long, what was the time frame that beds were held?
It all depended on the client. I mean, if the client was...
Give me a range, just a general idea.
18 months, depending on whether the client was ready to transition, if they needed more medical care, if they didn't have the right equipment, if we needed to hire more nurses or...
And so during that 18-month time period, the state paid for the bed, so it would be held and available once the resident was ready for transfer.
Well, there's no system in place, at least for Lanterman, to pay for those bed holds. So we're saying that we suggest that that be incorporated in your plan when you develop it, that there be a system of payment for those beds to be held. Otherwise, a provider, you know, they have these empty beds.
They can't keep it vacant.
Right.
Got it. My last quick question, with regard to the low utilization of the community state staff experience at Lanterman. Now, at Lanterman, it was low utilization, or that wasn't a part of the plan at all?
Low, I think, would be an overstatement.
So tell me why.
Well, that's not something that I could really answer. There was a subsidization set up and ready to be put in place. No providers really participated. There was one provider that I know of that did participate in the program, and I think one psych tech actually did transfer into the community, but that's it as far as my members. I couldn't actually tell you why, except for the fact that our input into the Lanterman closure and things that we learned from Ag News was not really sought or listened to. With Ag News, people had us at the table talking and listening to what it was that we were going to need and what it is that the providers were going to need in order to come up with solutions. And I think that's what happened with Ag News. I think there was a real you know, a commitment on both parts to try and get something that was feasible and workable. And then Lanterman seemed very hastily done and rushed.
So at Ag News, where you had the 2-year subsidy.
Yeah, you did a Lanterman as well.
How many of the employees, once the subsidy ran out after 2 years?
Not many.
How many then stayed on with the community providers after?
Not many. See, what happened was there was some, but there was not many, because they had the option to go to a full-time job at
an additional
Sonoma
DC.
Developmental Center.
So could we therefore assume that without an ongoing indefinite state subsidy, that the employees are not willing to make a transition into a different payment structure, different retirement structure, no longer being state employees, and willing to stay in the field and do the work?
It depends. I would say there's a variation. There's the older employees would probably be willing to do that for a little bit of time. But then there's the younger employees that have a career to really think about. You know, the way the current community state staffing program is structured, it is based on contracts. So if there's a 1-year contract, then that's the term of your job placement. You know, then you have to wait for another contract before you can get hired on to go work out in the community again. So there's no real incentive for state staff to invest into this program. Now, if it was something that was more stable, where you had the ability to go back to, you know, another developmental center and continue to work there and make sure you had a guaranteed paycheck, I mean, that's what our members are worried about. They're worried about a guaranteed paycheck. You have facilities in Sonoma, you're right next to Napa State Hospital or Vacaville or Solano developmental prisons. If they're young enough in their career, they're going to take those full-time and permanent jobs rather than, stay on. They're currently leaving Sonoma as it is, and they will continue to leave. I can't, in good conscience, tell my members to stay when they have something closing.
Thank you. Mr. Burton?
Senator Mitchell, I did, having participated a lot in the state staff process at Ag News, I didn't get a chance to talk about it, but we had a very strong commitment. There are great employees working today still in our area and for our services. We had great employees who joined Regional Center of the East Bay. We had one advantage that I don't think the Lanterman closure had. Many of those employees lived in our communities, so they were close by and near those resources. But on top of that, we had a huge commitment to try and employ and keep great staff in our service system. The service providers that we contracted with had that same commitment. And I can tell you that we still employ many folks who, if they aren't still on the state staff contracts, have retired and now are continuing their work, continuing to serve same consumers they served at Ag News, but able to earn another wage and another adjunct to their retirement by continuing to work for private employers.
I just think drilling down there is going to be critical because if we don't find the sweet spot where we're able to retain qualified employees to continue to work in this field, we have to find the sweet spot where people want to stay. And not only that, as I toured Sonoma, and everybody I met at Sonoma had been there 20, 25, 30 years, so I know we're going to hit a bubble soon where there's going to be a significant number of people who retire. And so then my ongoing concern is training and retention into the system to provide critical health care and support services to this highly specialized community. And now needing to do that in the community-based provider paradigm as DCs fade out. And so it's the interim, finding the sweet spots, we retain qualified people, but how we also attract them into a field, because if it's, because this is the caring industries, as Dion Aroner coined the term many years ago, it's not going to be just about a state-level salary, state pension, those kinds of things. The community cannot compete with that. That's just the reality.
I just had a quick comment. The average age of a psych tech at Sonoma, you hit it right on the head, is 50. And that's why I mentioned the idea of doubling the service credits, because if you double the service credits from, say, the date you guys adopt a closure plan, and you carry that through until the actual closure happens, and then for those people that stay in the plan, then move into say it's subsidized for 2 years, state staffing plan. That's roughly 5 years. That's 10 additional years of service credits, which gets them up to the age of 60. So, then their retirement looks much more feasible to where they can retire and then go work into a community-based home.
Got it.
And that's kind of the idea behind the doubling the service credits.
Got it.
Just a couple of comments on the Lanterman didn't utilize the state program as mentioned. The rates for the provider community serving Lanterman DC weren't adequate to support the higher costs of state employees. And the geographic distance from Lanterman also for those employees, I think with Ag News it was different. And of course, there was some lack of service provider interest, so.
Thank you for that. Thank you, sir.
No, thank you so much, Senator. Senator, do you have any questions?
I just was curious whether or not Dr. French had anything positive to say about Sonoma. Or, just in your presentation, you talked about it's tough, all the services are tough to replicate. Is there some things that are good things that we could do to decide?
Yeah. I actually think that the things that I mentioned, the reason I put them there is because I think there is a way to be creative. I think there is a way to bring a lot of this to maybe not the 24/7, but if the regional centers would actually hire the physicians to do what I do now, which is you make rounds on your patients, and to be available to the houses and to be able to talk with a nurse about all the important vital signs that you're following on that patient, to actually create a team-based management. We could do the same thing in the group homes. It's not impossible. It's just that the model that we're using, one of the things that Senator Mitchell alluded to, part of this is about creating the ability to train people to be as good in the community. And I think that that's what I really don't want to lose, is what I'm saying is that I've become a specialist in my last 9 years, and I don't want to lose that for this population because they sorely need it. And I don't want to lose the wealth of knowledge that exists with all the psych techs and the incredible behavioral implementation that they have. And this is the kind of stuff that we can actually become a model to actually be a beacon for the community placements. And so I think there's a lot of wonderful things at Sonoma that we can replicate. And I just think it really requires commitment from the state, and it requires commitment from the regional centers, and it requires exactly what you're talking about, collaboration. And everybody has to be brought to the table and welcomed.
No, thank you, Doctor. Anything else, Senator? Thank you.
Thank you.
I just quickly, Ms. Galazza, real quick, in regards to, I think one of the challenges that you said was low and frozen rates.
Yes.
We saw. So how have those rates, understand that we're going to get, knock on wood, a movement on the MCO tax this Thursday. How do you see that impacting the regional center system now, since we really haven't seen significant increases? It will be an increase, but it'll be targeted, particularly on some salaries and some on reimbursements. Can you talk about that a little bit?
Well, I think with the frozen rates, the issue back with Lannerman was that we could only go up to a certain median rate, and then if we went up to that, then we had to request health and safety waivers, especially for those clients that had severe medical needs and were in their 853 homes. We had to go through really a lot of paperwork to get them a rate that was going to work so we can have nursing staff there 16 hours a day. With the MCO tax, of course, that's going to help. That's going to help not just our specialized facilities for all of our clients moving out of the developmental center, but for our other 12,000 clients who live in the community already. It's going to help them in terms of those facilities not closing and having available beds for them. So I think it's just going to be an added plus, having the money there and allowing the regional center to go above the median rate and to negotiate something that's going to work well for a set of clients in a particular home.
Got it. No, thank you. Mr. Burton, anything you want to chime in on this one?
Just to say that we will need flexibility to cover the actual cost. The rates that have been set for many of the newer models are still relatively new. They're at least not 2 decades old and unadjusted. And I did want to also mention that throughout the recession, horrible recession that we went through, those rates were exempted from rate cuts to ensure that the promises that we made to families and to residents of Agnews were kept.
Oh, that's great. Thank you. And the other item you brought up, you did not use this term, but I'm going to use it. And what was the concurrent planning. What we need to be able to do is, we're essentially 2.5 years out. What are we doing now to make sure that we have our rear ends covered here by next year, right? As it's really going to start picking up. And I think one of the items that you're saying is pre-planning on these processes in regards to regional center system, because it takes time, whether it's issues of licensure for the homes to be able to hire up or potentially purchase the property. All of this takes a significant amount of time, and some of it is out of your control.
Yes, it is. So pre-planning now, talking to families, what areas you want to live in, what are the needs of your individual, what are the support systems that person needs, so that we can make sure we have that in the community.
Absolutely. Thank you so much. And someone had mentioned the staff report in the incredible legend who was in the back of the room, Peggy Collins, did such a wonderful job. I do want to say thank you to her once again for all of your work on the staff report. Thank you. She's only working 3 jobs at once, so it's great. So thank you very much. Let's thank our panel. Thank you so much. We're going to bring up our second panel. Thank you. All of you did a fantastic job. We're going to be bringing up now Michael Kotke, he's the Executive Director of Elwyn of California. William Liner, the Associate Managing Attorney with Disability Rights, California. We have Aaron Carruthers, who's the Director of State Council on Developmental Disabilities. He is sitting in for the Chair of the State Council, who is on your agenda, Dr. April Lopez, but we're excited Aaron is here. We have Debbie Batterson. She's a consumer formerly with the Sonoma Developmental Center. She is a former resident. We're excited that Debbie's here. We have Diana Pastora Carson. She's a family member of a former Fairview Developmental Center resident. We then have Dorothy Diamond. She's a family member of a former Lanterman Developmental Center resident. And last but not least, we have Jeremy Letrich Hardy, who is also a family member of a former Lanterman Developmental Center resident. We're going to give some folks time to be able to come on up.
There's not a microphone there, so.
All right, I think we're going to need a mic. Do we short one mic, or are we okay on mics?
Let's share them.
All right, we'll share. All right, again, thank you all for being here today, and thank you for your patience and for hanging with us. We're going to start out with Michael Kotke. He's the Executive Director of Elwyn of California. He's going to share with us his experience and perspective on the challenges faced and lessons learned from previous closures. So we're really grateful that you have taken the time to be here, and you have 5 minutes, and please don't take my pushing as being pushy, just making sure that we have everybody have some time. So thank you so much.
Okay, thank you. I appreciate the opportunity to speak today. I'm the Executive Director of Elwyn, California, and Elwyn, California currently operates 15 homes that were developed for people leaving Agnes Developmental Center and 15 homes for people who transition from Lanterman Developmental Center. About half of our homes are adult residential facilities for persons with special health needs. So those are the SB 962, SB 853 homes, and about half of our homes are specialized residential facilities for people with behavioral health needs. All of our homes are held in trust by nonprofit housing organizations, which was authorized through Senate Bill 2100. And I believe Elwyn was probably the largest customer of the Community State Staff Program, which was authorized through AB 1378. So I'd like to start by just saying that it's really an honor and a privilege to work under these authorities. Each of the pieces of legislation that I just mentioned have allowed for the assurance of a much higher level of quality care and long-term care than was previously available in the community in California. In terms of lessons learned, there are really many, as you've been hearing today. But from the service provider perspective, 3 really stand out to me as the most critical. The first having to do with healthcare, and some of these issues were mentioned already. But with the Agnes closure, the regional centers, DDS, the Department of Healthcare Services, all coordinated with local managed care health plans to identify physicians to provide healthcare services to people leaving the developmental center. And this included the a monetary incentive to have physicians who, with our population, often have to spend additional time, have to have specializations. A lot of our residents have very specialized healthcare needs, so there have to be certain sophistications that the physicians possess. And in our design, we also have physicians who come to the homes, because a lot of our clientele have a hard time going out to a clinic, dealing with a waiting room, with the transportation, that sort of thing. So that monetary incentive went a long way to help with the coordination of identifying physician services. With the Lanterman closure, there was not that level of coordination, and service providers were by and large sort of on their own to find physicians and to find physicians who would accept people's straight Medicare or Medicaid reimbursement. and we still made efforts, to find physicians who would come to the homes. So my recommendation would definitely be, given the nature of people's healthcare needs, moving forward with additional closures to have that level of coordination to identify physicians and work with local managed care plans to bring physicians into the home.
Yes, sir.
Okay, I'll be quick. The other issue is the Community State Staff Program, which has received some attention today. This is a great program. It allows for the continuity of care, continuation of relationships. It has an added benefit of providing additional assurances to families, but it's a very costly program. There's been some discussion today about supplements, but on the provider side, we haven't seen any supplements. We negotiate the same rates as providers who don't use the Community State Staff Program, and then we have to find within our budgets the ability to pay for the state staff, who not only is their hourly rate more expensive, but their benefit packages are incredibly high. So, and that's a cost that's passed through to the provider. So if there was a financial supplement or some incentive for providers to utilize that program, I think that would go far to assist the providers, but also to possibly expand the use of the program.
You have 30 seconds, sir.
Okay, probably the most critical lesson learned is that providers need to be kept financially whole through the process of opening homes. With Agnews, there was transitional funding to fill the gap between startup and ongoing operations as people moved into the home. Traditionally, providers are paid on a per person per month basis, and vacancies are not funded. With Agnews, providers were paid in full based upon the first placement, meaning we were paid as if there were 4 or 5 people already in the home. And that allowed us to stay financially stable as additional people moved in. It also put the pressure to fill the home on the regional centers and DDS because they couldn't justify paying, for a full home that had vacancies for an extended period. With Lanterman, the vacancies weren't paid. And so the pressure really was solely on the providers to fill the homes. But the providers don't have the same sort of leverage with the planning teams at the developmental center that DDS and the regional centers do have. And so that resulted in long-term vacancies and financial hardship for the providers.
I'm going to ask you if you could to conclude.
Okay.
Thank you.
In closing, California, I think, should really be commended for raising the bar. These few issues I brought up aside, they're important issues. I encourage them to be addressed, but the state has really raised the bar in terms of putting together a template that works for people transitioning out of developmental centers and really is an example for the country.
No, thank you so much. And I have some follow-up questions, which I'll ask at the end of the panel, if that works for you. And thank you.
Okay.
And again, I'm sorry about being pushy with you.
Okay.
So thank you very much for your time. We now have William Liner. He's the Associate Managing Attorney with the Disability Rights California. He's going to talk about whether residents are getting adequate support after they move. So welcome.
Thank you, and thank you for the opportunity to be here today. I have written comments that I think will be distributed to you shortly.
Thank you so much.
Again, my name is William Liner. I am with Disability Rights California. We provide legal services to people with disabilities, including advocacy services to regional center consumers, both who live in the community and who live in institutions. And I also speak as the brother of an individual who used to live in a developmental center. I want to first start by saying that the primary takeaway from really decades of closing institutions in California is that it's done more for the system than just save the state money. It's actually led to some really good outcomes. And we know this because of the nearly 40 years of professional literature that's been developed that shows what happens when people move from communities to the institutions. And what we see is that people show improvements in life skills, in job skills, in self-care skills. We also see reductions in challenging behaviors, but it's about more than just that. Because life in the community provides for freedom, dignity, it provides for independence and really opportunities to be included in communities in a way that's not always possible for people that live in institutions. I've seen this with my own brother who, once institutionalized, has been empowered, included, and embraced in a home of his own for nearly 20 years. But that doesn't mean that things can't be better. We wouldn't all be sitting here today if the horizon wasn't challenge-free. So here are some challenges, opportunities, and lessons learned that lie ahead of us. And first, number one thing that we've learned through the closure processes is that this is all about the individual. The individual is at the heart of this all. And that carefully crafted, person-centered individual program plans are essential for people's transition and also to the ultimate delivery of services that people got once they were in the community. But the information gathered through this process didn't always flow between developmental center staff, regional centers, and providers sometimes had to react to needs that weren't necessarily anticipated, and communication is key. And on that note, successful closures and the people involved in that process, rather than using a bunker mentality, I used an open door, problem-solving, practical, roll-up-your-sleeves approach, where the concerns and fears of residents and families and staff were heard, where they were explored and addressed. That was a key element of prior closures. And on the third point in I-5, a new generation of supports and services were essential to help with the Nantucket Agnews closure. We know that 962 homes, they were developed to fill a critical gap in licensure for people who have developmental disabilities and who need specialized healthcare needs. But more is necessary. The system needs to evolve and the state needs to quickly develop new homes, enhanced behavioral support homes, community crisis homes, can't say no facilities to ensure that the system can continue to respond to the needs of residents, current and former.
You have 2 minutes.
And we're also pleased to see that the department is open to looking at ways and exploring ways to keep the land in the system, and we support options like fully integrated inclusive settings on that land, similar to what's been developed adjacent to Fairview, the community at Harbor Village and the proposed development at Shannon's Mountain. Next, we've seen that with enhanced quality assurance and monitoring, we've been able to track outcomes of Nantermin and Agnews movers. It's been a really valuable source of information. But this information isn't always captured in a way that informs future closures or more generally our service delivery system. So for this reason, we also support reinstating legislation that was repealed in 2009 that mandated independent annual studies of people that move from developmental centers to the community, where the quality of community programs were tracked, outcomes were tracked, satisfaction with services were tracked for all individual movers. And in the packet of materials I've given you, there's examples of some really valuable, comprehensive reports that have arisen out of those mover studies, which no longer exist. And lastly,
You have about a minute, and I apologize.
it's okay. Lastly, we've learned that success, it's a process. It's not a single event. It's not you do this thing and then that happens. And it takes time to build the community capacity and oversight that's necessary to make sure that people's needs are met. But we've also seen that with the right supports, some barriers are more easily overcome than others. For example, with the assistance of our clients' rights advocates, residents and their families have been able to more easily identify appropriate community homes and eliminate barriers to transition. And more importantly, we are able to remain a resource and advocacy resource to people after they move. And with the closure of the remaining developmental centers, we hope to see funding for additional clients' rights advocates that can continue to serve this purpose for residents and their families after they move. So again, I appreciate the opportunity. I just want to conclude by saying that grateful to be able to discuss the lessons learned in the past, and I hope that we're able to use these lessons to make a better future for our clients.
Selena, I really appreciate your advocacy. It's obviously very personal for you, and cannot tell you how valuable it is for all of us to be able to hear it. So thank you very much. And it's interesting looking at the Stockton mover study, right? And being able to go back and see what's worked, what were the outcomes, et cetera, was really valuable. And you're absolutely right. One of the items that I will ask, not now, but the department to be able to come up after this panel is, what was the budget? I don't know if anyone remembers back in, I think it was 2009 is the last time it was funded. Anyone, not asking you right here, right now, but if anyone knows how much that actual annual cost was, that would be interesting to know. So thank you so much. We're now going to be advancing to Aaron Carruthers. He's the Director of the State Council on Developmental Disabilities. Director Carruthers is going to describe the communicative and collaborative process between the developmental centers and consumer advocates throughout the closure process. We're grateful you're here and welcome. And again, not at all trying to be pushy with you. Just 5 minutes, sir, and I'll just give you a 2-minute warning.